Full Circle Women's Care started 10 years ago. We actually turned 10 just this year. We practice obstetrics a little differently than a lot of other practices in town because we're a collaborative midwifery model practice. The traditional midwifery model takes care of women who are low risk. The collaborative model, however, is special in that if you develop a complication with the pregnancy, you can still stay under the care of the midwife, but you have physician collaboration, so to speak, directly in hand.
She's a special woman. There's an aura about her that is deep, almost spiritual. I can see why mothers come to her over and over and over again to deliver their babies and trust her with their babies.
I am the direct descendant of Granny Midwives. My great-grandmother was a traditional granny midwife, and she trained my grandmother to be a traditional granny midwife as well. My mom was a guidance counselor, so she kind of went off the path. I have a very cool article, my mom's birth certificate, where my mother is the baby, my grandmother is the patient, and my great-grandmother was the midwife delivering her daughter. So
she brings unique techniques in her delivery, in her labor for patients, so that it makes it easier for patients and more relaxing for patients.
I am absolutely a proponent of changing the status quo. I think that's the only way that we can keep ourselves in check, is making sure that we are always delivering the best care to our patients. So we are one big happy family. I have a wonderful husband who's very supportive, and we have 3 awesome children, 2 boys and a girl at home. And then we have an older daughter who is 24, who is about to enter physician assistant school. Both sets of grandparents are within walking distance from our house, and so my kids call it the triangle of cookies because they can just go from house to house collecting sweets and things from everyone. Many people may not know that I did dance competitively. I grew up dancing actually in high school. My high school band went to the Macy's parade, the Macy's Thanksgiving parade. When the band stopped in front of Macy's, I was the one who was on camera, so everyone back home at Thanksgiving was watching. Sudoku puzzles and crossword puzzles are definitely my favorite way to relax. I need something to slow my brain down. Like I said, I'm always going a mile a minute, if not faster, thinking of the next thing and the next possibility. So I need a good puzzle to distract me from what else is running through my head. There's a gap between people who qualify for assistance and those who don't, and the amount that has to be earned in between there, they just kind of get left out. I mean, the good thing about pregnancy is that everyone who's pregnant does qualify for pregnancy Medicaid. So they don't really have that same gap during pregnancy, but the issue is the health conditions that they're bringing into pregnancy. They're not getting that care to optimize their health before they become pregnant. And so when they get pregnancy Medicaid, it's 8 months of trying to figure out all the problems you've had your whole life. And then 6 weeks after you're not pregnant, all your care goes away again. So that's the space where volunteers in medicine can just sort of bridge that gap to optimize them before they send them to me for care.